Well, I can totally understand. They've been waiting since a long time and they're quite low at the moment. But, anyways, welcome to each and every one of you, and especially our esteemed guest for today. That is from Avicenna Badumi Medical University, that is Dr. Katuma ma'am, who is a nephrologist and the director of this university, and of course, Mr. Gurram, who is the deputy director, and of course for the international collaborations, right, and relationships. Wonderful having you over here. And then we have the Texas Review team, Mr. Rajesh Kumar Dasari, who is the CEO, and of course the lovely Harshini Rajesh, and Karthik Nambiar, and Sarika, you didn't write your name, but I will still remember to take your name though, right? Well, welcome to each one of you. And look whom they have called, me, to refer the students to do their MBBS somewhere else. Huh? Oh, this is so ironical, but still I support my students. Apart from being a director of a medical college, I support my students. No matter wherever they do MBBS, it should be the right place, right? I'll be very glad if they do it in India because, of course, I'm a proud Indian. But if at all they don't clear their NEET and they are upset about it, so doesn't matter. That's not the end of the life. We have seen something mishaps happening recently, not just because of they were unable to. I mean, they had to rewrite the exam of NEET. So let us not dig into it. But I request all the students that it's okay. It's just a life. If at all you don't get a chance to write it again, or if at all you fail writing it again, never the mind. You have amazing universities even abroad, not even just in our country, right? And you have other things to do as well. But yes, if you're keen in doing MBBS or being a medical doctor, then of course I would suggest you amazing universities. For example, we have Georgia sitting right in front of me. And I was just talking about this university with ma'am because before I endorse it, before I support it, I need to know. One thing which actually clicked my mind and I was very super happy about it is the teaching hospital strength they have. So we have in our India, we have a norm, like we have 500 beds to begin with and then so on, right? So for every 100 seats or 150 seats or 200, 250 seats, there is a particular number of beds. But the number of beds they have is 6,000, which is actually a very good number. 6,000 is the beds in the hospital, and they have multiple clinics, and that what has made me really, feel good about this. That yes, our students, because I feel that unlike any other education, I think MBBS, the most important thing, I think the soul of the entire medical system is the hospital. If you don't have a good hospital to to have this hands-on experience or hands-on training and experiential learning, there is no point in running a medical college. So it's very important to have a very good teaching hospital. Very good in the sense, I mean, with plenty or ample clinical material, patients, so that they expose themselves to multiple, cases during their tenure. And it's a 6 years course, right? And once they want to come back to India, you all know that you have to pass an exam which is called as FMGI, right? FMGI, if I'm not wrong. And then yes, you're back to our country. And Georgia is such a beautiful place. I know. So I think you can enjoy a beautiful weather and of course do your medical education very well. So hats off to the team, and I request to the Georgia team that we are handing over our students to you. We are sending our Indian students to you, so please take care of them is what I can say from my side, being a Indian. So thank you so much for giving this opportunity to our students so that they complete or fulfill their wish of becoming an MBBS doctor. Now with this, I would also like to add a little bit about what we are doing in our campus, ma'am. We all know that AI is everywhere, and my father-in-law is fond of this word. It's AI and artificial intelligence, and he's everywhere with this. The reason why he's talking about AI, and because he's really feeling it. We all know every day we see so many applications in our mobile. ChatGPT तो पुराना हो गया, right? वो I'm still there. But when we have Gemini, so many things, agentic AI is the new thing. AI Co B, there is a new one born that is agentic AI for all the administrative work and all that. So it's great to know that we all have multiple applications. But how important AI or how can an AI support in education? One is providing a good quality and a personalized education or personalized assessment, I would say, because not all the students are on the same platform. Sometimes a student is doing well, sometimes they are not. They have to have a personal self-assessment through AI. So this AI module, whenever we put in education, it helps each and every student to learn according to their standards. Not every student is bright, sometimes they are not good. So, and the second thing is, it keeps you entertained. Sometimes it's like, one chapter is good, other chapter is not so great, you feel bored, but AI makes it very entertaining is what I feel. This is AI in education. Whereas the other way around, I feel that not only just MBBS doctor, but any graduate, if they don't know how to use AI, they'll be soon be replaced by any graduate who will know to use AI. That's the future. In fact, I would say that's the present. It's an alarming present. So, how many of our medical colleges are actually integrating AI in their education? Not just the learning part, but also teaching the students how to use AI in their particular subject. Like we have introduced a AI integrated curriculum in our campus for our MBBS as well as BDS. BDS is dental education, as well as pharmacy, then agriculture, nursing, allied, everywhere. Because AI is a tool and we all have to get empowered with it. AI is not replacing anyone. Let me tell you, I think by now you all must be knowing. AI is not replacing anyone. It is empowering us. It is giving us an extra capacity to do the work better, efficiently and precisely. I would say that. So, and personalized. When it comes to hospital treatment, AI gives you a better edge to have a personalized treatment, personalized diagnosis, to know patient to patient, one-to-one relationship. Because during COVID, we have understood that there used to be a time when the OPDs were full. Now I would say that the telemedicine or teleconsultation is totally full. Because wherever the patient it is, doesn't matter. Of course, a personal routine checkup, one-to-one checkup matters a lot. But still, if at all he is unable to come, nevertheless, you are always on the screen, very connected to the doctor by multiple ways, whether it is telemedicine, by OP consultation. You have a lot of medical devices and variables where he'll be always real-time monitoring is done by the doctor for the patients. So many things are coming up, let me tell you. So I think technology, there used to be time. First ఉంటుండే టెక్నాలజీ ఇంజనీరింగ్ వేరు మెడికల్ వేరు ఇప్పుడు అంతా మర్జ్ అవుతుంది ఇంటర్ డిసిప్లినరీ అయిపోతుంది ఎవరెవరు ఎంబీబీఎస్ చేస్తున్నారో వాళ్ళు కూడా టెక్నాలజీ జాబ్స్ కోసం వెతుకుతున్నారు దట్స్ అ ఫ్యాక్ట్ ఎంబీబీఎస్ అయిన తర్వాత మీరు ఎండీ చేయాల్సిన అవసరం లేదు ఎంబీఎస్ చేయాల్సిన అవసరం లేదు మీరు డైరెక్ట్గా టెక్నాలజీకి వెళ్ళి మీరు ఇంజనీరింగ్ వైపు కూడా చూడవచ్చు ఎందుకంటే ఫైనలీ మనం కొత్త కొత్త అప్లికేషన్స్ చేస్తున్నాము మనం ఇంజనీరింగ్ సైడ్ అది వాళ్ళకి హెల్త్ రిలేటెడ్ ఆస్పెక్ట్ వాళ్ళ హెల్త్ నాలెడ్జ్ ఉంటే ఇంకా మంచి అప్లికేషన్స్ చేయగలుగుతాం ఎస్పెషల్లీ ఫర్ ద మెడికల్ అండ్ డెంటల్ సో దాట్స్ ద నీడ్ ఆఫ్ ది అవర్ అండ్ దిస్ ఇస్ వాట్ ఐ హావ్ అండర్స్టూడ్ చాలా మంది చాలా అప్లికేషన్స్ దేర్ వాస్ అ రీసెంట్ one I would like to tell you one thing which actually struck my mind is they came to me and they said that ma'am we have created an AR/VR application for medical teaching okay for example anatomy of heart so they just kept the the VR to me and they said ma'am this is the anatomy of the heart I said okay who made this because there were mistakes దాంట్లో మిస్టేక్స్ ఉంటాయి సో ఐ సెడ్ ఇట్స్ ఇస్ వెరీ గుడ్ అందరు స్టూడెంట్స్ కి బాగుంటుంది కదా విఆర్ పెట్టుకొని మంచిగా హార్ట్ ఎనాటమీ చదవచ్చు ఇట్స్ వెరీ డిఫికల్ట్ టు కట్ ద బాడీ అఫ్ కోర్స్ డిసెక్షన్ ఇస్ ఇయర్ రేప్ క్యాటవర్స్ కూడా కష్టమే సో ఈజీ టు లెర్న్ అండ్ ఎంటర్టైనింగ్ సో ఐ జస్ట్ ఆస్క్ ద క్వశ్చన్ మీకు ఎలా వచ్చింది హౌ డి యూ గెట్ దిస్ థాట్ ప్రాసెస్ ఎనాటమీ ఆఫ్ ద హార్ట్ ఎట్లా తెలిసింది మీకంటే మీరైతే ఇంజనీరింగ్ కదా బీటెక్ కదా అని అడిగారు అవును మేడం బట్ I went and I got trained under a cardiothoracic surgeon for 6 months to create this application. So he is a BTech graduate and there is no knowledge of anatomy, physiology and biology. or chemistry, biochemistry. He goes to a cardiothoracic surgeon to learn and then come and do. No matter how much ever he tries, he cannot be perfect. ఎందుకంటే ఎడ్యుకేషన్ బీటెక్ లో ఉంది. హౌ కెన్ హీ మేక్ అ అప్లికేషన్ ఇన్ ఎంబీబీఎస్ ఆర్ అ మెడికల్ ఆర్ అ డెంటల్? ఇట్స్ నాట్ పాసిబుల్. మీకు కొత్త కొత్త ఇప్పుడు రోబోటిక్ ఎక్విప్మెంట్స్ చేస్తున్నారు, బయోమెడికల్ ఇంజనీర్స్ అండ్ ఆల్ దట్. దట్స్ గుడ్. బట్ వాళ్ళకి తెలుసా ఎనాటమీ ఎట్లుంటుందో, ఫిజియాలజీ ఎట్లుంటుందో, బయోకెమిస్ట్రీ ఎట్లుంటుందో తెలియదు కదా. సో ఇమాజిన్ ఇఫ్ దెర్ ఇస్ అ కోర్స్ వేర్ while doing your BTech or while doing your MBBS, you have given an extra edge of learning how to make such applications. Okay, BTech వాళ్ళకి కొన్ని కోర్సెస్, okay, let us also explain you some anatomy, physiology and biochemistry so that you can make applications related to the medical system. Then it becomes very easy and very authentic and very correct. Pratidanki, instead of just getting some certification, it's better to have a degree, right? So we have created this interdisciplinary courses like so many, like medical devices and variables, digital health. There is a lot of integration of medicine and technology in our campus. So this is what we are, and I think we are reimagining the world beyond. And I'm glad that we are doing this. So we have created courses like degrees in digital dentistry, dental technology, aesthetic dentistry. We all know we have created a course called as digital pharmaceutical supply chain management. Iyalre man pharmacy lo elli ante choostunte మొత్తం అసలు ఎంత డ్రగ్స్ స్టాక్స్ అవి ఎంత ఉంటాయి, కానీ మాన్యువల్ గా మనం ఎన్ని రోజులు పడితే చెప్పండి, ఎన్ని ఎర్రర్స్ మనం అంటే చేస్తాము ఒకవేళ క్యాల్కులేట్ చేయాలంటే ప్రతి ఒక్క డ్రగ్. But here, everything is on the laptop, everything on the iPad. It's easy for you to calculate that how many drugs are getting expired, how many drugs are actually ready to be used, or which are the most demand pharmacy drugs. So idantha enduku possible undante because of AI. AI toni it makes just easy with a click of a button to tell you that which drug is the one which is going to expire very soon and which is the one which is most demanded. Even vaccination, with even research kosam enno vishayallo we can use AI. So what I feel is that there is a lot of scope where we have this interdisciplinary emerging areas of learning, and I hope that the Georgia University also integrates AI in their curriculum so that our doctors are much more advanced than the others. So thank you so much for inviting me, and sorry for making you wait, and I hope all our students, no matter wherever they study, whether it's in India or abroad, they need to be a successful doctor. Thank you.